Now, I bet your doctor isn't telling you this. We are finding out that dermal fillers made of hyaluronic acid may still be in your face up to 12 years later and can actually migrate from the intended site. And hyaluronic acid loves water. That means your filler can be migrating over time to look like those faces. On top of that, it's taking way longer to break down than we thought and absorbing water. Now, I'm gonna give you the lowdown on filler. Is it smart? Is it safe? And I'm gonna tell you the healthier alternatives and the dosing on the newest episode of Heal Thyself. All right, fillers, everybody seems to be using them, especially if you're out here in Los Angeles. I'm going to talk about what are they used for, how many people get them, what are the different types, what are the risks, how safe is it, how efficacious is it, does it even work, and what are the alternatives. Now, fillers are also known as dermal fillers or soft tissue fillers, and they're substances that are injected into the skin that help fill the face from wrinkles. They provide nice volume, they enhance your facial features, and they're commonly used in cosmetic procedures to reduce the signs of aging and just improve your overall facial contours. When it comes to fillers, people are going in there to get wrinkle reduction, right? That's what we all want. And fillers can smooth out the fine lines, the deep wrinkles, especially the ones right here on your nasolabial folds that I'm just touching on right now. If you got me on video, those smile lines, the marionette lines, the crow feet that we have. I got a little bit of those sometimes, you know? And a lot of people are using those for that, but they're also using them for lip enhancement. This is really popular, and man, it's hard pressed to find a woman in LA who doesn't have lip filler. It's kind of crazy actually, and no judgment, but it's just kind of crazy when you see how many people out here have it. Fillers are commonly used in the lips, and they add volume and they help define the shape if you get it done right. But they also use them on the cheek, and they can add volume to the cheeks. A lot of people who are getting older are starting to put them on the cheek now to keep that youthful, contoured face appearance. A lot of people, seen a lot of men using them on the jawline and the chin, enhancing their jawline, giving them a more defined look. Women also. Under the eye, hollowing, right? As you get older, you lose that collagen, that plumpness, that robustness to the face. And a lot of people are using them to reduce the appearance of dark circles or hollows under the eye. When it comes to fillers, they've grown. They've exploded. I mean, I didn't really hear much about fillers when I was young, but the global dermal filler market is valued right now at $5.31 billion, actually valued as of last year, which is crazy, right? And it's expected by 2028 to go up to $8.74 billion. More people are using it. I mean, look, if I was another doctor in another parallel universe, I'd be making hella money injecting men and women with fillers. It's not in alignment with me. I think whatever. But anyway, in North America, we love fillers. It is dominating the market, right? And we are accounting for actually the highest demand for significant cosmetic procedures, especially when it comes to fillers. Europe is there too. It's a substantial market, but oh my God, United States, we are obsessed with it. Asia is definitely one of the fastest growing ones too, due to their having more disposable income and growing acceptance of these procedures. But America, this is where it's getting done, and this is where people are coming to get it done. And there are different popular types of fillers. Now, you may have heard someone go, I got filler, and not know the type that they have. And each one has a different function. So if you're even interested in getting them, you have to learn about this first. There's so many popular different types of fillers, but when it comes to the market, hyaluronic acid is 70% of the market. It's the most popular one. That's the Juvederm one that you may have heard of, or the Restylane one that you may have heard of. Those are the leading brands. But when you think about the age distribution, there's actually younger people getting fillers now, which is crazy, right? Their face is full of collagen. What are you guys doing? 20 to 29 years old, there's increasing numbers that we're starting to see where individuals are actually adopting fillers to enhance preventatively, just for preventative aging. God, we can't even age gracefully, right? Like preventative aging in their 20s, we're getting fillers. That's crazy. 30 to 45, that's the largest group of people seeking fillers for wrinkle reduction and facial rejuvenation. And 45 and over, that's a growing trend among older adults. And they're looking for significant anti-aging effects for, you know, they look old, they say, they feel old, it's in their head, they go get some fillers. Women, as you'd expect, dominates this market at 90%, although there's an increase in men. It's about 10% of the market, as you think, but like there's an increasing trend now. More and more men are starting to think about it, especially in the jawline one that I mentioned. So there's different types of fillers, and if you are going to get fillers, listen to the show first, and maybe try the alternatives first over time. Everyone wants a quick fix. Give it a year and see if there's improvement, consistently, internally healing instead of trying to look young externally. But There's different types of fillers, and you should know about this before you go get it. Hyaluronic acid, that's the most popular one, as I mentioned, and it's naturally occurring substance in the body, in the skin, and it helps keep the skin just hydrated and plump. And it's popular because they're temporary, although we're going to talk a little bit about that more, as I mentioned in the opening, and reversible. And again, that's the Juvederm, the Restylane, the Belotero. And basically these fillers attract and bind water. They add volume to the injected area, and they can be dissolved with an enzyme called hyaluronidase if necessary, if there's too much. And a lot of people I've known have had that dissolved, their lip filler dissolved because it was too much. Now, you know, I've been thinking a lot about gut health lately, and what seems like everywhere you turn, there's a headline about how important it is, the talk of really functional naturopathic medicine. And at the same time, we are bombarded with stories about supplements that aren't regulated, they're not tested properly, they don't deliver on what they promise. I'm always excited to talk about Puri because it's such a transparent company. And when it comes to taking their products, they're one of the only companies that I really, really trust. There's only like a handful. And I want to share some of their fantastic stuff that they have out there. Puri is committed to purity. Every batch is clean certified and is tested by an independent third party against more than 200 different contaminants. That means heavy metals, pesticides, all the nasty things that I tell you about on this show to stay away from. And I'm going to tell you about two of the products I'm particularly excited about. That's one of their probiotics is the Puri SB3. It's got the two most scientifically backed probiotic strains out there, BB12 and PCC, and it's packed with prebiotics. Remember, that's the food that helps those good bacteria in your gut thrive. But I also want to mention their omega-3 supplement is one of my favorite ones. As someone who's really focused on physical activity, you know that I've been focused on incorporating high quality omega-3s into my routine, and it's made a big difference. It helps with overall muscle synthesis and recovery. Recovery is a big one, especially as you get older. And I noticed real improvement on how it works after these intense workouts that I'm doing. If you're interested in trying Puri's omega-3, I got a great deal for you. Puri is offering you, the Heal Thyself listener, 20% off site-wide. And here's the best part. This discount even applies to their already discounted subscriptions. So we're talking about nearly a third off the regular price. And to get this offer, go to puri.com/DRG and use the promo code DRG. That is PUORI.com/DRG. And don't forget to use the promo code DRG at checkout. Always looking for ways of staying healthier, easier overall. And one of the simplest things we can do is drink more water. But here's the thing. If you're like me, you might not trust tap water, right? And we shouldn't, because I've done many shows on what's in tap water, and for good reason. Now, according to the Environmental Working Group, 3 out of 4 homes in America have harmful contaminants in their tap water. This is why I always talk about AquaTru. I've talked about AquaTru as one of my favorite filters for the past 5 years. I've discovered their water purifiers back in 2018, probably 19, and it's been a game changer. AquaTru uses a 4-stage reverse osmosis purification system that removes 15 times more contaminants than any other ordinary pitcher. And the best part is it's countertop. So the purifiers work with no insulation or plumbing needed, which was a really big sell for me. What impressed me about AquaTru is how they tackle PFAS. These are the forever chemicals that have been hot center of attention, and they found that almost 45% of US tap water has PFAS. So AquaTru is certified in removing these contaminants along with 80 other harmful substances like chlorine, fluorine, and arsenic. And you can truly taste the difference compared with old water filters. It's remarkable how cleaner and fresher the water tastes. And one of the things I love most about how versatile it is. These filters are incredibly long lasting, and just one set of filters from their classic purifier makes the equivalent of 4,500 bottles of water. That's less than 3 cents a bottle. And if you're interested in trying AquaTru for yourself, you got a great deal by being a Heal Thyself listener. You get 20% off of any of their purifiers, and they come with a 30-day money-back guarantee. So there's no risk in giving it a try. To get this offer, go to aquatru.com. That is AQUATRU.com, and enter the code DRG at checkout. The next one is calcium hydroxyapatite. And this is a substance that is found naturally in bones. And these fillers are used for deeper wrinkles to enhance facial contour. One of the brands that is popular is called Radiesse. Radiesse, I don't know. I think that's how you pronounce it, but you may have heard it. Your doctor may have brought it up in a consultation. That's the one they're talking about. It's the calcium-centric ones. And basically, the calcium particles in the filler provide immediate volume and stimulate collagen production over time. It's a little more permanent. And then the last ones are the polylactic acid ones, the PLLA ones. These are biocompatible synthetic substances, and they're stimulating collagen production. And the brand name for this one is Sculptra. And unlike other fillers, when it comes to this one, PLLA, you don't get immediate results. It's instead, remember, it's stimulating collagen production that appears gradually over a few months. And this is a biocompatible substance. It's staying in the body and creating more and more collagen. You'd see more volume and the support of the skin structure over time. But more important than even these types of fillers are the safety and efficacy. Do they work? So I want you to think about this. If you're thinking about fillers, I would venture to say that probably your doctor or nurse practitioner isn't sitting down and going over the full list of common side effects or even more serious ones, right? So this is not done to scare you. It's just simply done to inform you. You have to know, right? If so many people are getting, it's going to go into $5, $6, $7, $8 billion industry. That means a lot of people are getting these. You should be informed. So first and foremost, common side effects. You can notice, as you'd expect, immediate reactions like swelling or bruising, redness, pain at the site of injection within a few days. Maybe delayed onwards, you might notice some lumps, some bumps, some nodules that can actually be there for weeks or months. And it could be managed most of the time by massaging or maybe additional treatments. There are risks for more serious complications. Although they're rare, infections, of course, can occur. With any procedure performed, infections, of course, can occur, especially when there's not a procedure that's performed under a sterile environment, right? And a lot of these med spas aren't necessarily following strict rules. So signs are going to start to include redness in the area, swelling and pain that's not going away over time. One of the ones that's most alarming is vascular occlusion. This occurs when basically the filler is accidentally injected into a blood vessel, and that can lead to local tissue death. And in some cases can block that tissue, cause ischemia and blindness, right? Like you can get blind from a filler if the filler is traveling to the eyes, especially when it comes to treatments with hyaluronic acid. So if there's any symptoms of pain or tissue pain, spasming of the tissue, changes in your vision, immediately you have to go to the doctor to get some hyaluronidase to start dissolving that blockage, which was injected into the blood vessel. Again, rare, but it happens, and you need to know about it. Another one is migration that I talk about in the opening for this. Fillers actually can sometimes move from the injection site, right? You get lip filler and it can end up on your cheek. You get cheek filler and it can end up in your jaw, right? You get filler on your eyes and it can end up on the other eye, right? So let's think about this, okay? Like that's a risk. And oftentimes what we're seeing is that because these fillers aren't breaking down as much as we thought or as fast as we thought, and they stay in the body over time, and I'm going to talk about it in a moment, that, and they're hydrophilic. They love water. They suck up water over time. You're getting this filler. It's not broken down. It's sucking up water, and it's sort of going to distort the face over time. Not for everyone, can happen for people, and everyone's at risk, right? So filler can move from the injection site and it can cause asymmetry in the face. And you need a corrective procedure. There's also, as I mentioned, the long-term presence. We believe that actually filler would be able to break down faster. Hyaluronidase will be able to help break it down, but sometimes it's not fully, the enzyme not fully breaking it down, and it can persist in the body much longer than we expected, up to 10 to 12 years post-injection. And remember, the non-dissolvable fillers like the calcium one, the PLLA, and even PMMA, they're not dissolvable, and basically the body's going to break it down. So you want to think about that before you even make a decision on getting one. But back to the persistence of the hyaluronic acid fillers. Despite them being marketed and probably told to you by the surgeon or your cosmetic dermatologist that these are temporary, hyaluronic acid fillers have been found to persist in the body much longer than we initially expected. MRI scans have detected hyaluronic acids in patients up to 10 to 12 years post-injection, particularly in areas when you're getting them without blood flow, right? The areas that are getting less blood flow, they're just staying longer and longer, right? Because you're not getting all those enzymes to break it down over time, right? And that's that's around the eyes. That's a big one. So when you think about the challenges over here, right? That we thought that maybe they have a timeline of 6 months to a year, but really they can stay a lot longer, right? Hyaluronidase is the enzyme that they use to break it down, and it's super crucial, especially when you have results where your lips are huge or your cheeks are huge or it just didn't work out the way you wanted to. They can inject that enzyme and it's going to help break it down. Remember, it wouldn't necessarily break down everything, so it wouldn't have a full reversal. And again, hyaluronic acid injectables can stay in the body much longer, okay? And oftentimes when you're using this hyaluronidase enzyme, you might have to go for multiple sessions to even start seeing the difference of the breakdown. Usually when they do it with ultrasound, that actually helps because it'll improve accuracy and efficacy. So make sure that your doctor is doing ultrasound guided just to make it faster if they overdid it or you're not happy with your results. Some people are sensitive to hyaluronidase, so they may have an allergic reaction to the enzyme, which would be problematic, especially if you're not happy with your results, but it happens also. But when it comes to just overall efficacy of these fillers, they work, right? People are actually getting volume restoration, wrinkle reduction. It can last to 6 months to over a year. Some people are happy at getting their results. I would venture to say that they don't always look natural, even with the best doctors. So I mean, from me, the outside looking in, and I'm much more of a fan of stimulating collagen naturally versus injectably. And this isn't to bring down anyone who's made whatever lifestyle choices. It's just to bring more awareness to it, which brings me to that. What are some alternatives, right? Now, look, we are in a fast-paced society. We want to immediately go to the next video. We want to go to the next person on the dating app. We want to go to the next person to date outside of dating app, who's my new boyfriend, new girlfriend. We want to go to the newest trend, newest stuff. We want everything new now. And for better or for worse, it's really affecting our attention span and our ability to be patient. And patience is going to be a really, really important piece to this, because when it comes from internal anti-aging benefits that you're seeing inside out, it takes a while because your body needs to heal what's happening inside before it even cares about the skin, right? The skin is the last thing the body cares about. So if you really want to look healthy and glow and have hydrated skin and a lot of collagen being made, you got to start with a lot of things, mostly a lifestyle change. Now, kudos to all of you. I know most of you listening have a really healthy diet, but I'm going to go over some more focused specifics, nuanced stuff about how to take the approach to have healthier, glowing skin, more plump, more robust, right? A lot of this is genetics. A lot of it also is epigenetics, meaning that you can make a difference. So let's talk about some things. Now, collagen is the name of the game. Collagen is the thing that makes your skin plump. It's a skin thing that's broken down and you start seeing wrinkles. So collagen, collagen, collagen. How do we support collagen? Skin health overall, really important. Now we talk about collagen peptides. Do they always work? They don't always work, but for some people they do work. Why? Because the peptides used in collagen can be used for other processes in the body if your body needs it. Remember, the skin is the last thing the body cares about. So the peptides in itself, if your body can utilize it for the skin, will be used, and it'll be used well. And there is some research behind it. Dosages up to 2.5 to 10 grams per day of collagen have been shown to actually really help. There's a study published in the Journal of Cosmetic Dermatology that found that a daily dose of 2.5 grams, just 2.5 grams, that's not a lot. That's like a cup of matcha of collagen peptides, improves skin elasticity, hydration, reducing wrinkles after 8 weeks, right? 8 weeks, remember, patience, slow it down. And there's another study in the Journal of Skin Pharmacology and Physiology that showed significant improvements in skin texture and reduction in wrinkle depth when there's a daily intake of 10 grams of collagen over 12 weeks. You see, 8 to 12 weeks before we're even seeing differences. So look, you can go get injectable, you could see benefits, but there's a lot of risks out there and they're going to stay in your face for a while, or you can take some patient time and start creating a ritual to have more long-term sustainable effects and probably cheaper. Now, the amino acids for collagen synthesis are really important because if you're not getting enough of these amino acids in your diet or even supplementally, then it's going to be hard to make collagen. Glycine is a big one. Glycine is found in multiple foods. It's really rich in chicken and gelatin and bone broth. Those are really major ones. Maybe some in fish. You want to just make sure you're getting an amino acid rich diet. There's a lot of diets out there that don't look at the importance of getting enough protein, and getting enough protein is going to be really important for your skin. Proline is the other amino acid that helps make collagen, found in egg whites, dairy products. Cabbage has a lot of it. Mushrooms have a lot of it. And then the third one is hydroxyproline. That's another amino acid that helps make collagen that's also found in bone broths, gelatins. Those are the big ones. But when we think about all of them together, we really want to make sure overall, like some of you might even need this support. Like I don't eat most of the foods on this list, but I do take protein powder in, right? So I'll use it in my post-workout smoothie. I'll use it in my morning smoothie, right? I'll have 2, sometimes 3 a day because I'm working out, and it's really helpful that I know that I'm getting enough amino acids, not only for my gut, not only for my brain, neurochemistry, but also for my skin. Really important though is you have these amino acids and they help make collagen, the scaffolding of collagen, but the cofactors in making collagen, meaning that these help drive the synthesis of collagen. Vitamin C is huge. If you're depleted in vitamin C, your skin is not creating enough collagen and you ain't looking young. People who look young have good levels of vitamin C in their body, okay? Citrus fruits, or you already know, oranges, the lemons, the limes, the grapefruits, right? But you may not know the berries, the strawberries, the raspberries, the blackberries, things I eat every single day, and I know I'll be looking young. Bell peppers, really important one. You can get red and yellow ones. Those are rich in vitamin C. Kiwis are fantastic, also fantastic for pooping. Leafy greens, spinach, kale, dark leafy greens overall. Getting more vegetables. God, I always think about like how there's carnivore diets that are saying like you get all your foods that you need in here. And like you watch these, I mean, I hate to hate on the carnivores, and it's not hate, it's just a real observation. You watch so many of these people who are on a carnivore diet over time and they're aging. They don't look young and robust. It's like their skin looks old, but their body looks young, right? Like they're fit and they have 6 packs, but their skin is not. It's because they're not getting enough collagen supporting nutrients. They're not getting enough vitamin C. A lot of these people on the carnivore diet are deficient in vitamin C because vitamin C is coming almost exclusively from plant vegetables. It's coming almost exclusively from plants, right? The fruits and vegetables. And vitamin C is so important for collagens. And that's my little theory as to why I see a lot of these people on these carnivore diets for a long time and being big proponents of the carnivore diet, but they looking old, right? They're aging. You want high doses of vitamin C, especially for collagen synthesis. Some of the optimal doses for supporting your skin and your joints for vitamin C go from 500 milligrams all the way up to 1,000 milligrams per day. And that's going to be helping to enhance collagen production and improve your overall skin health. Many dermatologists are out there recommending 1,000 milligrams for patients who are looking to improve skin elasticity. Some clinical studies go up to 3,000 milligrams. You might be pooping a lot if you're up to there, but that's like a dose that I would use when I was in practice and people would have surgery. That was for wound healing, post-surgery. That's helping create more collagen so the person is healing faster, and it did help. Other important cofactors for skin, copper. You can find that in oysters, crabs, lobsters, sunflower seeds, sesame seeds, cashews, organ meats, dark chocolate. Zinc is an important one. You find that in beans, legumes, pumpkin seeds, sesame seeds, shellfish, different meats. Silica, another fantastic one. You find that in whole grains like oats, barley, brown rice, fruits like bananas, mangoes, and apples, vegetables, green peas, spinach, cucumbers, and herbs like horsetail and nettle leaf tea. Nettle leaf tea is a fantastic one, especially if you have allergies. Really good, but also good for the skin. Now, there's a lot of numerous studies that show that red light therapy, ladies and gentlemen, is fantastic. I'm telling you right now, if you do vitamin C rich foods, if you supplement with vitamin C, if you supplement with collagen or just eat the collagen rich foods or the precursor for the amino acids and you get a protein rich diet and you do the red light therapy, man, you do it for a year straight. I don't even know if you're going to want to even get any of those injectables because it works, right? There was a study in photomedicine and laser surgery. And this study found that participants who received red light therapy showed a significant increase in collagen density and a reduction in wrinkle depth compared to the control group. Another study in the Dermatologic Surgery Journal, a randomized controlled trial, it demonstrated that red light therapy significantly improved skin texture, tone, and elasticity in participants with increased collagen and elastin production. There's systematic reviews that have shown that it's a conclusion. Red light therapy is effective for promoting collagen in the face. Multiple studies, meta-analysis, skin rejuvenation. Multiple studies, elasticity, firmness, reduction in fine lines. I'm telling you right now, red light therapy, I don't know why it has not broken out to the mainstream as far as beauty. It is the beauty hack. It is more important than any beauty serum, any beauty regimen, even supplement regimen. Red light therapy is fantastic. If you are listening to this, shoot me a DM. I'm going to send you my favorite red light one that I use out there, the one that I use every single day. And how are you going to use it? So if you go and get your red light, most studies are recommending that you use the red light therapy 2 to 3 times per week. I use it 2 times a week at this point, and each session for 10 to 20 minutes. And it depends on the device and the specific treatment area. I will say this, a lot of these red light therapies that are the masks, you've seen that one, like the silicone mask, or it doesn't have to be silicone, something like plastic, and they shoot red light on the face. A lot of them are weak, really weak. I'm researching and I'm looking into finding the strongest one that is almost equivalent to the handheld. But at this point, most of the handhelds are going to be stronger. The consistency, you want to use it consistently over weeks to months, right? You're going to notice, I've done it myself, and people are like, whoa, what are you using for your face? When I use it consistently for 1 month, people notice. Use it for 3 months and see if you want to still get your injectable. It's going to be crazy. Telling you, man, somebody needs to crack that on the beauty and the red light. They need to bridge that, and it's got to blow up soon. And lastly, one of my favorite things that I know works, but I've never done it until I'm actually going this week to do my first session ever, Cosmetic acupuncture. It is fantastic. It's facial acupuncture. It's non-invasive in a sense of like they're not cutting you open, they're just putting acupuncture needles, and it helps reduce the signs of aging. Now, is there studies behind it? Yes. It's increasing blood flow. The fine lines are increasing oxygenation to the skin. They're actually helping produce more collagen with these micro traumas to the skin. And it's creating more elasticity and firmness to the skin. There was a study in Dermatologic Therapy journal that indicated that acupuncture can actually stimulate collagen production. They showed it, increasing muscle tone, releasing less tension, so your face is more relaxed but more toned. And cosmetic acupuncture is fantastic. It can actually help with also lymphatic drainage, stimulating and detoxification. So reducing that puffiness, that swelliness that a lot of people have in their face, that bloated face. And there was a study in the Journal of Alternative and Complementary Medicine that found that acupuncture can enhance lymphatic drainage, which is reducing swelling, which is improving skin clarity, right? You want clear skin, not blotchy, not red. You want clear skin. It's helping with that too through the lymphatic pathway. So how are you going to do it? Initially, you're basically going to go once or twice a week for 10 to 12 sessions, and then maintenance would be every quarter or so. Yeah, so the way I'm going to do it is go once a week for 8 to 10 weeks, and then I'm told that I would do it every quarter after that. So, if that's within your wheelhouse, go look for someone around you who does it. These sessions are about an hour. I would not think anymore. You might do a whole Chinese medicine protocol if you want, but I'm going in for that. And lastly, protecting from the sun. I'm not a fan of the sun. I'm a huge fan of the sun. You need sun. Just make sure that when your skin and your body's telling you no more, you honor it, or you protect yourself with a proper amount of SPF. Anything over SPF 50 is going to be kind of a scam. So if it's at 50, it's 50. It's going to protect you. Make sure you're reapplying it. Go back to my sun show. I break it down exactly how to do it. So there you go. Look, if you're looking to have filler, go ahead. I ain't judging you, but make sure you're informed. Listen to the show, take notes, find out exactly what works for you, and then do it at your risk. You have to understand nothing is just a super free and safe in this field of dermal fillers. There's risk. Some things are rare, but there's risk. So make sure that you are clear on what you want to do. And if you're hesitant, then maybe take a step back, try all of these alternatives, do it for 6, get yourself invest in a fantastic red light. Like I said, DM me, I'll send you all of my favorite ones. 6 to 8 weeks, do it. If you can do it longer, check even 6 months of like really sticking to really good collagen, really good vitamin C rich foods, getting enough protein in your diet, movement, water, exercise, good sleep. Maybe you do the acupuncture and definitely the red light See how your skin changes. It's going to be crazy. Your family's going to be like, what are you doing? What serums are you using? What is your secret? And your secret is just letting the body do what it needs to do. You're just giving it what it needs to heal. I really hope this episode helped you. There's a beauty episode on fillers. Thank you so much for listening.